Now, that rock star of the University of Kentucky, Jacqueline Noonan. The pictures on the left side of the screen are from approximately 50 years ago. Now, 50 years ago, Jackie Noonan wasn't here yet. She came to the University of Kentucky as a young physician in 1961 and remains a young physician in 2010. In 1962, she described what has become called Noonan syndrome. I mention that in part because the pictures on the right side of the screen, the more contemporary ones, include one at the top that is on the Noonan family website, the Noonan syndrome support website, that I understand was a collage made in Jackie's honor of pictures of young patients with Noonan syndrome. You think she's a rock star here. You go there and talk to the families who have gotten to know her, who have called her over the 50 years when a diagnosis has been made. They think she's a rock star too. Now, I'm not going to talk about that though. I'm going to talk about attitude. I think focusing on Jackie's attitude and setting the tone. In my experience with her since meeting her in 1995, I have found that she is almost unfailingly, excuse me, Jacqueline, sometimes nauseatingly, enthusiastic, with tremendous warmth, optimistic, welcoming. She presumes the best about people, and she also gives people the benefit of the doubt. I've learned so much from her as my teacher, role model, mentor, and eventually friend. For our conversation, I want to mention that, she has been the senior physician in many rooms. And when she walks in as the senior physician, evaluating residents or students with whom she works, as the physician working with parents struggling with some of the most terrible events that they face, a child's illness and sometimes death or substantial disability. In all of these times, Jackie is the one who's helping to set the tone. And when I have seen her, she has been unfailingly able to set a positive tone, to find the best in students, in her colleagues, in situations, to focus on the capabilities and promise of her patients, even while acknowledging the problems and empathizing with the child's and parents' pain. Her work with families of children with Noonan syndrome have demonstrated her time and time again to be an uncommon person with a common touch. I had an opportunity to run into a parent at one point, and the point that the parent wanted to make to me was, A, they had actually met Dr. Noonan. She had come to one of their meetings. And B, do you know she was a regular person? So, Jackie allows us to think about our attitude. Our attitude as students working in small groups, faculty members teaching medical and graduate students, physicians walking into the clinic or into our office. Our attitude makes the difference. Will people we work with feel valued? Will our colleagues feel that they can tell us of an error or a medical mistake or a research problem? Will patients understand that we are there to serve them, not ourselves? We are in a time of enormous change in our country, in our healthcare system, in our higher education system. Sometimes it feels like we're out of control. What we always have control over is our own attitude and the tone that we help set in the places that we go into. So Jackie reminds us to think about our attitude and the tone we set when we walk into a room over the next year and over the next 50 years. The third person is Ms. Wanda Whitehouse. Wanda was my colleague in the Office of Academic Affairs from 1995 to 2002. 50 years ago, she was in high school. She recently retired from the University of Kentucky. Now, let me just say right here, The Office of Medical Education, when I knew it as the Office of Academic Affairs, is quite simply one of the most amazing places I have ever worked. The mission dedication, the commitment to students, and the passion for education are stellar. Wanda was my administrative assistant, often my right arm, sometimes my right and my left arm, and frequently my alternate brain. She was so much a part of our life that when I heard my daughter, my 3-year-old daughter, then telling people that her mom worked for President and Mrs. Clinton, and I knew I didn't, but this is a bright child, and I explored with Nancy Claire why she said that, it turned out that I was always talking about Mrs. Whitehouse. And so how she put that together was that I worked for the Clintons. So whether it was meeting prep, LCME self-study, she was there. I bring her up to remind us that we don't do it alone. In our profession and in the academy, there is a tremendous emphasis on the medical student, the senior scientist, the physician. There's a great temptation to think that it is all about us. Now, the issue is not limited to our work families. It extends to our home families as well. Frequently, we start to think that it's all about us and not them. This is a wonderful book. I love it. I was stunned to find my name in it, but I love that too. I will point out that it is one example where I think I found the name of one spouse in it, Mrs. Strauss, and I saw a couple of staff people in it, but they were mostly named unidentified. And the unidentified ones didn't look anything alike. So I'm not sure that was their real name. Individualism is great. Us achieving individually what we can is wonderful. But increasingly we recognize that teaching, research, clinical care is done in teams. Let's Mrs. Whitehouse be a constant reminder to us over the next year and over the next 50 years how important teams are and how important it is to recognize that our success is our team's success. And finally, I want to speak about someone who is very dear to this community, Richard Schwartz. If there are any new students in the audience, you may not know that Richard Schwartz was a talented surgeon and a leading surgical educator, academic physician, and a visionary. I want to talk about Richard Schwartz's passion because he was one of the most passionate people I ever knew. And he pursued his passions, whether they were surgical education, telling me what needed to be done and what I was doing wrong, or leadership development. I remember when Richard decided that we needed to have more leadership development of physicians in the University of Kentucky Chandler Medical Center. He came and talked to me about it, and I strongly supported what he was saying, but didn't have the resources to do anything about it. He returned a week later, walked into the office unannounced, and said, "I'm going to the chancellor," and outlined for me that he was going to go to Jim Holsinger. Well, Richard Schwartz left my office, and I thought to myself, Holsinger doesn't have a chance. It turned out that, of course, Chancellor Holsinger had a similar vision. But the next thing you knew is we had a certificate in medical management in this college that many of us benefited from. And that was the beginning of a number of us going on to get our MBA. That program has been talked about, published, and impacted leadership development of physicians across the country. So the work that Richard did in that one small area in which he worked impacts all of our lives. We all have our passions. For some of us, hopefully most of us working here, most people working here, a lot of that passion is in our work life, whether it's in the administration, in the laboratory, or in the operating room. For others, it's in this broad community that the University of Kentucky serves through its remarkable outreach. For others, it's in our church or our children's school. But let's use Richard's example to remind us over the next year to find our passion and honor it, because our passions are what call us to leadership. Sadly, Dr. Schwartz is also a reminder to us that we may not have 50 years in which to make our impact. So it's important that we treat each day and find our passion and use it each day. So here we are, folks, the University of Kentucky College of Medicine at 50 years. What a wonderful institution and what tremendous accomplishments. I congratulate all of you who have made it possible. 50 years from now, the University of Kentucky College of Medicine will celebrate its centenary. I will not be there. Many of us will not be there, although undoubtedly some of us, students, we're looking at you, will be there. What people will say at that 100 years will absolutely build upon the work of Ed Pellegrino, Jacqueline Noonan, Wanda Whitehouse, Richard Schwartz, and all of you. And UK at 100 will build upon what we continue to do day by day, month by month, year by year in our areas of influence. I would suggest that following their examples, searching for virtue, living virtuously, setting a positive tone, working as a team and recognizing our team members, living each day with passion, we can help make it another great 50 years for students, patients, Kentucky, and the rest of the country who very often, as I told the young man who was interviewing me before this, looks to the University of Kentucky College of Medicine to be shown how to do it. Thank you very much.